There are a number of factors in diabetes which predispose or contribute to this non-healing wound status. The first of those would be neuropathy, and neuropathy simply means damage or injury or disease affecting the nerves. Okay? And the nerves do various things. One of those is feeling, and diabetics frequently will lose feeling on their foot and become numb and simply not feel rocks in their shoe, for instance, or stepping onto a nail. Diabetics also frequently have problems with their blood flow. They have vascular insufficiency, meaning they don't have enough blood flow to get down there and heal the wound. And this is a typical neuropathic ulcer on a diabetic foot. It's at the bottom of the foot. It's under the ball of the foot, under one of those metatarsal bones where there is added pressure. Prolonged pressure over these sites can lead to breakdown. Poor circulation doesn't cause a sore or wound or ulcer to develop, but if one develops a sore, such as from trimming the toenails, or develops a blister inside of the shoe, you've got to have blood supply to heal it. What we recommend is changing those modifiable risk factors for atherosclerosis. So smoking, quitting smoking, want to get their blood pressure and their diabetes and their cholesterol, all those sorts of things under control. But in patients with significant blockage, we're going to recommend some type of revascularization procedure to improve their blood supply. To do a balloon angioplasty or stenting, or it can require actually a fairly large operation to get around blocked blood vessels. Frequently what we'll do, if you've got blockage through the thigh arteries, we'll do a bypass around it. We'll simply put a new hose in there, sew it in above the blockage, we'll bring it down and sew it in down below the blockage, bypass around the problem. The normal status of the veins is that blood is always flowing back up and towards the heart, and there are valves in various locations which will close if the blood tries to go back down. So those valves keep the blood flow only in one direction, but unfortunately in some folks those valves aren't working well and the blood flows down, has problems getting out of the leg. You get more blood collecting into the leg veins, and as that more blood is in there, the pressure in those tubes tends to go up. And that venous hypertension is what causes problems with venous ulcers. So what we do about vein problems is we wrap them tight or get something tight on them to squeeze those veins empty. Also very important for patients with vein problems, after we get their ulcers healed, is to get a good pair of socks to provide that continued squeeze and emptying of those veins. The important thing for the diabetic is to get the pressure off, so it's usually some type of a shoe or shoe insert to offload that sore. These people need better blood flow. These people need some sort of a compression to empty those veins and bring that. There are all other essential steps for evaluating anybody with a chronic wound that will do as well. Those include, number one, assessing their blood supply. Number two, treating infection if it's there. Number three, we want to get in there and do something called a debridement, which is to get in and remove all of the non-viable bad tissue that's on the top of that wound, so we sort of clean it up with debridement. We want to make sure that the swelling is adequately controlled or managed. We want to get the pressure off the area, as I said, especially with the diabetics. We want to control the moisture. We want to improve systemic factors, including especially nutrition, to make sure that there aren't any nutritional issues that are contributing to that wound healing failure, and to control pain. Also, is a main goal of wound care. This is a plug for wound centers for patients with chronic wounds, and there is a lot of technology which is available to aid. Once you've gone through those basic steps, there's a lot of technology to aid wound healing. There are skin substitutes that you can place on the wound. There are lots of different offloading boots, wraps. There are growth factors that you can place on the wound. There is something called a wound vac, which is a negative pressure suction device which we can place on some wounds. And there's something called hyperbaric oxygen treatment. But there's a lot of technology that goes into healing chronic wounds, which is not available in most physicians' offices, including my own office supplies on hand, but there are wound centers to help